Hi, welcome to your checkup, where we bring health topics from the doctor's office to your ears. On this podcast, we try to bring medicine closer to its patients. I'm Ed Dulesky, a family medicine resident in the Philadelphia area.
And I'm Nicola Rufo. I'm a nurse.
And we're so excited that you can be here with us today. Awesome. What are we going to talk about today, Nick?
Well, today I hear we're talking about golfer's elbow.
We certainly are. Golfer's elbow, otherwise called medial epicondylitis. You know, a lot of guys who I threw javelin with ended up with this.
So it's not exclusive to golfers?
No, not exclusive to golfers, not exclusive to baseball players like pitchers, but any overhead athlete. And it's that motion. It's the golfing motion that kind of leads to the injury. So we could definitely talk about it more here today. At the elbow. And so the elbow joint is made of the humerus and this part, importantly, the ulna, which are two bones in the arm. So specifically, there's like the wrist bending muscles that attach there. So if you were to have your palm up towards the sky and then close your fist and curl it in, like you're going to do a bicep curl, or you're going to curl your wrist in, then there are muscles that attach right at the elbow. And if you use them too much, they pull at that point, and too much of that can become an issue, leading to this inflammation.
So it's an overuse injury?
It's exactly an overuse injury. I think that's a great way to put it. And so moreover, it's called golfer's elbow, but people get this from their occupation all the time. And so it's a very, very common thing, which is why we're talking about it here today. So yeah, to say it out loud, there's common culprits include different occupational exposures with whatever you're doing during the day, overhead throwing sports, baseball, personally, javelin was important to me. And it's just like your body's saying like, hey, too much is happening here, so we need to take a break.
What does golfer's elbow feel like? Or have you ever had it?
So I don't think I specifically had it. Maybe I did. I tore my ulnar collateral ligament in college when I was throwing javelin. But in the rehab, I think I ended up having golfer's elbow because of the strain on the arm when you're throwing like that. It's when you're doing a specific motion, you get this kind of, it can be like a sharp nagging pain right on the inner side of the elbow. And that's kind of what it feels like.
So if someone came to you, how would you diagnose this?
So I would take listen to their story, first of all. That's super important. And I would try to find out what they do and where specifically they're having their symptoms and do a physical exam. And I would have them make a fist and I would have them resist against my hand in a certain motion that's tough to say, like your palm facing down and then facing up. And I would have them resist.
So like make those pulling muscles work. And then if they hurt,
exactly,
that's a sign.
And if they hurt, that's a sign of that. And I would also press on their elbow and see if it hurts. And if it does, if it's tender, then I have a pretty decent idea about what's happening there. You can have something on the outside of the elbow too. It's similar. Tennis elbow.
Oh, a different sport.
Different sport.
Different part of the elbow.
A different part of the elbow.
Wow, these elbows take a lot.
And that's the extensor. So like if your wrist is going like palm down and then you're going to go up and you're like putting your up, the extensor muscles are the ones that are being strained. Whereas the medial epicondylitis, golfer's elbow, is the palm up curling motion in. Tough to describe on a podcast.
Okay, so someone comes to see you. You've diagnosed them with golfer's elbow. What do you tell them to do?
So I'm telling them to really think about what they're doing during the course of a day that bothers them. And some of the point is to avoid some of that motion, but it could be hard. And so they're kind usually in
the classic, if it hurts, don't do that.
Classic, right. If it hurts, don't do that. But sometimes people need to be told out loud. And usually a nice anti-inflammatory will do the trick. Now, this one's tricky because it has to be prescribed by your doctor because everyone listening has their own individual medical history. And there are certain things that make anti-inflammatories unsafe.
And you're not anyone's doctor here.
And I'm not anyone's doctor. Listen to our disclaimer at the end. Sometimes ice can be helpful. And what I'll say about ice, though, is from my own personal experience, a lot of athletic trainers will recommend less than 20 minutes because the ulnar nerve, the nerve responsible for fist-making muscles and sensation in your pinky, runs right in the area where the ice will be. And if you ice it too much, that area will go numb. And I'm pretty sure that my grip strength on the right side, even though I'm right hand dominant, from years of icing my elbow a lot, might be a little weaker because I just chilled my nerve.
Oh my gosh.
So don't do that. And then back to the anti-inflammatory. There's a nice topical one. It's a topical anti-inflammatory that I really like for patients because it's kinder to the stomach and easier on the kidneys. And if that's prescribed by your doctor, it's also available over the counter. But that can go right on the area, which might be nice to avoid any systemic effects for any of our more vulnerable people who are listening. And then the really cool one is an actual little device. I kind of want to paint the picture of a guitar player, and they want to change the tone on the actual strings of the guitar. So they put that band, if you've ever seen someone play the guitar, they put the band in a different spot on the guitar and it changes the tune. So it also changes the place where the band is, where the chords are being strummed from, and it makes it a higher pitch. So I bring up that analogy to say that there's a band that can go on your forearm and change where the pulling motion happens from. Because the pulling motion from the forearm muscles happens at the elbow. If you can wear a band around your arm, then the pulling motion goes to where the band is, and it gives that area a break. So that's a neat one that I picked up during residency that, people don't often come back for golfer's elbow if it works. So I'm hoping that they get better.
Do you need that band prescribed by your doctor, or can you just buy it somewhere?
No, that one you can just buy. Yeah, you could buy that. And it might be a tennis elbow strap, but it functions the same way. And so like a forearm wrap, looking for something like that is a good place to start. So to sum it up, avoiding the activity, ice for a short amount of time, anti-inflammatory if appropriate and prescribed, and this band that changes the leverage of the muscles and where they're being pulled from.
Cool. So how are we rehabbing this golfer's elbow?
This is where we lean on physical therapists, and I would definitely reach out, ask for a prescription to see them. They are excellent, and I would not underestimate return to your sport or activity without their guidance. And so I think they're incredibly valuable. There are detailed plans. There are exercises that increase the strength in certain parts of the arm and advice that you can get. If it's in the upper extremity, it may be occupational therapy. And so make sure you tease that out with your doctor, because that's going to be an important part of you coming back from this injury pain-free, especially given it's an overuse injury. So I would totally defer to them. Oftentimes you can find exercises online, but it's nice to have that personal touch from a physical therapist.
Is this something that can easily be fixed with a surgery?
I don't see this usually get surgery, and I think it usually gets better with the conservative treatments. Sometimes if things aren't looking the way that they should, you do all the right things, you take all the right steps. Sometimes you need to take a second look at it and perhaps get some more imaging. Are we really dealing with golfer's elbow, or is there another injury in there? There's more anatomy in that area, and so not all that is inner elbow pain is golfer's elbow, but it's on the list, and it's probably the most common. So that's what I would say. We'll do the conservative stuff first, and then if it comes to surgery, if it didn't work, you think about that later.
Cool. So are there ways that people can prevent this, maybe prevent it from happening again, or if they are one of these people who does an overhead sport, maybe is a golfer, things like that, how they can prevent this and have a healthy elbow.
Yeah, having a healthy elbow, I tell you. I mean, having someone, elbows are important to me, as you know. I would say it's the overuse injury piece. So you have to be careful not to do too much in your sport, and take the recovery slow and be diligent, and find out what makes it worse. And if you have to use the strap during the activity, then you use the strap during the activity, or use it 50% of the time. Use it a couple days out of the week when you do it. But that's what I would say. I would say you just have to be thoughtful about your body and listen to what's happening.
I think that sounds great.
I mean, you've never had this, have you?
No, not in swimming. I really messed up my shoulders, though.
Oh,
We could do a whole nother episode on.
We could. You don't even have, I mean, you don't have any rotator cuff at all, which could perhaps be a nice thing that we talk about. So today we spent some time talking about golfer's elbow, otherwise called medial epicondylitis. We talked about what it is and a little intro to the anatomy of the elbow and what that looks like. We talked about how it occurs. We talked about what the symptoms are and what your clinician might look at to help diagnose this and how it's treated, and then returning back into the activity that you love so much or work, and how to prevent this in the future. So we really thank you for coming by and appreciate your time. And we hope you come back soon. And most importantly, stay healthy, my friends.
Bye.
Make sure to subscribe, rate, and review wherever you listen to your podcasts. Follow our Instagram, Your Checkup Podcast, and visit our website. Or don't, because we don't have it yet. And most importantly, stay healthy, my friends. Until next time, I'm Ed Dulesky.
I'm Nicole Rufo.
And that's Ollie. Thank you and goodbye. This information may provide a brief overview of diagnosis, treatment, and medications. It's not exhaustive and is a tool to help you understand potential options about your health. It doesn't cover all details about conditions, treatments, or medications for a specific person. This is not medical advice or an attempt to substitute medical advice. You should contact a healthcare provider for personalized guidance based on your unique circumstances. We explicitly disclaim any liability relating to the information given or its use. This content doesn't endorse any treatments or medications for a specific patient. Always talk to your healthcare provider for complete information tailored to you. In short, I'm not your doctor.
I am not your nurse.
And make sure you go get your own checkup with your own personal doctor.